Good morning and welcome to your Farm and Home Show. My name is Joanna Coles, and this morning we're visiting with Dr. Michele Arnold. She's the Ruminant Extension Veterinarian at the University of Kentucky. We're going to talk about an important topic, and that's persistently infected calves. And I think a lot of times we farmers lose money because it's something that we don't maybe necessarily see.
Correct, yes. So just for clarification, so persistently infected or a PI calf means that that calf was born with the BVD virus. So that's the only way they can become PI is they're born with it, which means the dam was infected early in her pregnancy with the virus, and it crossed the placenta and infected the calf. So it's born as a PI, will always be one for life, and it remains a shedder of the virus in its entire life from every secretion, nasal secretions, saliva, urine, feces, everything coming from that animal, even hair, has the virus in it. And this so obviously can spread the virus widely.
And so, with the naked eye, can you tell which calf is a PI calf?
Sometimes you can. There was a bull that won the Wisconsin State Fair that was a PI. So obviously that one must have looked great. So no, you can't really tell by looking. So for cow-calf producers, what BVD will look like to you is a reproductive dysfunction. You're going to have calves open that should be pregnant. You might have some abortions, may have some stillbirths or some congenital defects in the calves, but overall, it's just that your reproductive performance is not where it should be. So we recommend for testing purposes, test the calf crop. Don't start with your cows, test the calves first. And if anything is positive, then you want to test that calf's dam. And so that is the best way to approach testing. Testing is easy. It's just a skin, a notch of skin taken with an ear notcher like we use for pigs. And it's a very cheap test, $3 to $5 depending on what lab you use. The skin just needs to be put in a Ziploc bag and kept cool. You can freeze them, and that won't hurt the test either. But the nice part about this test is once negative, always negative. So you test them one time. If they're negative, you're good to go.
Is there a proper age for testing or a recommended age?
It can be any time, as long as you're using skin. If you want to use blood, which you can use a blood sample, they have to be over 3 months of age.
And so if a farmer says, I've vaccinated for BVD all my cow herd for years, so I shouldn't have any problem with PI calves. Is that an accurate statement?
And that unfortunately is not. Our vaccines are good, but it's a very, very high bar for a vaccine to reach to keep that transplacental infection with the virus. So because of that, you really can't say, even though well vaccinated, that they are protected. If they're still being exposed to the virus, it can override a vaccine. So that's why we have really a three-pronged approach to BVD control. And one is identifying those PI calves. Second step would be vaccination, keeping that herd immunity up. And the third is biosecurity, which is where we fall down, really. That is our main problem is purchasing animals that are positive and bringing them in the herd. If you purchase a pregnant female, be it a cow or a heifer, and she's pregnant, and you test her, she may be negative, but the calf she's carrying may be a positive. So if you don't test that calf at birth, you're going to miss that.
So would you recommend keeping those animals quarantined away from the rest of the herd until you knew for sure?
Until you know for sure, that's the best way to do it. It's often difficult to have quarantine facilities or separate facilities for new animals. If that's not possible, then just try to sample that calf as soon as it's born. I mean, we can do it as early as a day old. The most important thing is you don't want a PI calf running around in the pasture during breeding season, because that's how the next generation of PIs are created.
And if you have questions, make sure to contact your local veterinarian. We appreciate you watching the Farm and Home Show and hope you have a great day.
Thank you.